So, in continuation from the part 1, coming to part 2, my dear great friends, diagnosis of the pregnancy, we are sharing, we are enjoying the learning. What are the symptoms in the first 3 months or first trimester? We call is amenorrhea, that is the absence of menstruation. This is very, very useful in calculating the expected date of delivery. Patient will have morning sickness. If it becomes excessive, that is not good. That we call as hyperemesis gravidarum. It arises from 6 weeks to 12 weeks, that due to increased levels of human chorionic gonadotrophin. Bladder disturbances due to the pressure of enlarging gravid uterus and breast discomfort due to increased vascularity and enlargement and fatigue. On examination, breast changes is most valuable in the first time pregnant woman, we call primigravida. The evidence is more from 6 to 8 week onwards. The breast becomes enlarged with vascular engorgement, more pigmented nipple of the areola is more pigmented. Montgomery tubercle is a small protrusion like a tubercle is known as Montgomery tubercle. Thick yellowish secretion that is known as colostrum can be expressed as early as 12th week. There is a skin change, is called chloasma. For abdomen, until 12 weeks it's a pelvic organ, later it becomes abdominal organ. Pelvic changes, vagina, there is a Chadwick sign or Jacquemus sign, Oceantus sign, and non-irritating copious mucoidal discharge. Cervix becomes bluish discolorations, it's called Goodell's sign. Uterus becomes soft, enlarged, and globular, and Hegar's sign is a soft isthmus softening. Investigation, you can do hormonal test and ultrasonography. Hormone is the principal detection of antigen present in the maternal urine or serum, either with polyclonal or monoclonal antibody. There are various tests used, immunoassay without radioisotopes, immunoassay with radioisotopes, all in the principle of pregnant woman urine containing human chorionic gonadotrophin. If it add with human chorionic gonadotrophin anti-serum, what happens? There is a neutralization of the antibody. Then you add with human chorionic gonadotrophin coated latest particle, there is no agglutination. That means it's pregnant. Whereas in non-pregnant, for example, the urine is not having human chorionic gonadotrophin. If we add human chorionic gonadotrophin anti-serum, then antibody is not neutralized. Antibody is still there. Now you add up human chorionic gonadotrophin coated latest particle, visible agglutination, that means it's non-pregnant. The chemical or preclinical pregnancy recognized by estimating serum beta human chorionic gonadotrophin at the time of implantation before even amenorrhea occurs, the day 20 of gestation, when the beta ICC level is just more than 25 international units per liter. The ultrasound is a beautiful machine. Now we can do many things. Gestational sac, we can see at the 5th week. Fetal pole and cardiac activity at the 6th week. Embryonic movements at the 7th week. Crown rump length from head to foot, the length 7 to 12 weeks if we can measure is plus or minus 5 days, and Doppler fetal heart rate by 10th week onwards. And also you can diagnose by ultrasound blighted ova, pregnancy outside is called ectopic pregnancy, multiple pregnancy we can diagnose, and herediform mole. Now coming to the second trimester, what are the symptoms? The amenorrhea continues. Morning sickness and bladder symptoms gradually disappears. Breast and abdomen continue to enlarge. Quickening they feel, that's very important. An examination, linea nigra, stria gravidarum, all this pigmentation, uterus palpable and breast changes, colostrum. Braxtonix contraction you can feel. Externally you tap one side, other side you can feel there is external ballotment. Fetal poles are palpable. Active fetal movements are there, fetal heart sounds. Internally ballotment which you don't do nowadays. So investigation, ultrasonography, 18 to 20 weeks. You can find out gestational age, anomalies, integrity of the cervical canal, placental localization. Coming to the last trimester, The symptoms, amenorrhea will be there, enlargement of the abdomen, frequency of micturition, fetal movements, some discomfort, dyspnea, palpitation, sometimes varicose veins, braxonics, fetal movements, fundal height. You can see fetal position also. Investigation ultrasound, gestational age, growth, amniotic fluid index, and placenta. So, the important functions of routine ultrasonography confirms the gestational age, diagnoses anomalies, diagnoses multiple pregnancy, Doppler study reassuring the couple, integrity of the cervical canal. What are the differential diagnoses? Sometimes we miss. What are the differential diagnoses? Pseudocyesis. They think they are pregnant, is not really pregnant. Ovarian tumors, fibroid uterus, encysted tuberculous peritonitis, hematocolpus and hematometra. The bleeding collects inside and distended urinary bladder. Thank you, my dear great friends. Just